We all have a role to play in emergency and disaster preparedness. By knowing your role, you can prepare for what is within your control. After an emergency, the lingering effects of unexpected emergencies and disasters are different for everyone. Knowing what to do after an emergency can help reduce stress and aid in a quicker recovery. An initial rapid check should be made. First, survey the scene. Are there any environmental hazards that expose you or the patient to danger? If the hazard threatens your life, do not proceed. If the hazard threatens you or the patient, perform immediate evacuation. Call or speak to the patient, introduce yourself, and ask, "May I help?" If the patient does not respond to your question, tap the patient on the shoulder and shout to see if the patient responds. If the patient can respond verbally, even with a moan, you know he or she is able to breathe. If the patient does not respond, call for assistance from another party member and then check for breathing. If the emergency medical system is available, call for an ambulance. Look, listen, and feel for breathing for no more than 10 seconds. If the patient is not breathing, or if you can't tell because of the patient's current position, move the patient to his or her back while supporting the head and back. Open the airway. When there is no reason to suspect a neck or back injury, place the palm of one hand on the patient's forehead and tilt the head back until the chin is in vertical position. Place the tips of the fingers of the other hand under the bony part of the patient's chin and lift the jaw up and forward. Check for breathing. With the airway held open by the head tilt and chin lift, turn your head so you can see the patient's chest and abdomen, and place your ear and cheek next to the patient's nose and mouth. Look, listen, and feel for breathing for no more than 10 seconds. Look for movement of the chest and the abdomen. Listen for the sound of air movement. Feel for air movement against the side of your cheek. If the patient responds, proceed to check for severe bleeding or any injury. Inform the patient that you are about to check for severe bleeding or injury and will be touching his or her body. If the patient is lightly clothed, visually scan the patient for severe bleeding or injury. If the patient is wearing heavy clothing, do a hands-on check for severe bleeding starting at the head. Quickly run your hands over all surfaces of the patient's body, including those next to the ground. Be sure to get underneath bulky clothing and near to skin on the patient's trunk and his or her limbs. Check for other injury. Interview the patient. What happened? How did it happen? When did it happen? What hurts? Do you have any other problems or medical conditions? Observe the patient's emotional state, physical position, and ability to answer simple questions. Check the pulse. Find the pulse at the neck or wrist. Count the number of beats in 15 seconds. Multiply the finding by 4 and record the results. Check pulse below an injury. Test a capillary refill. Check the rate of the breathing. Place your hand where the patient's abdomen and chest meet and count the number of movements in a minute. Record the rate and any unusual characteristic of the breathing. Determine the skin's appearance and temperature. Begin the head-to-toe examination. Check the head, face, eyes, nose, mouth, ears, and scalp. Do not move the head or neck while doing the examination. Look for signs of bleeding or presence of other fluids. Look for any asymmetry in the face or in facial movement. Look for any signs of fracture or other deformity. Look in the ears for fluid. Look for blood in the eye or the presence of contact lenses. Look in the patient's mouth for wounds, loose teeth, or other injury. Ask the patient to open his or her mouth. Feel for any bumps, depressions, or blood. Start at the back of the head and work to the top of the head, then check the front of the head. Have the patient follow your fingers with his or her eyes. Hold your finger above 18 inches of the patient's nose. Move your finger towards the top of the patient's head and then back to the center of the face. Move your finger towards the patient's chin, then left and right ears, each time stopping at the midpoint. Note any inability to move the eye or the tendency of eye to continue moving when your fingers has stopped. Both eyes should move at the same time in the same direction. Check for equality of pupil size and responsiveness to light. Check the neck, upper spine, and upper back. Do not move the spine while doing the examination. Look for any deformity or bleeding with the neck, including abnormal position of the head with respect to the neck. Feel along the spine and upper back, beginning at the top of the neck. Feel for any indication of deformity, bleeding, tenderness, or muscular spasm. Check the chest and shoulders. Look for any obvious deformity or discoloration. Look for any indication of wounds or bleeding. Look for any abnormal motion, such as one section of the chest collapsing while the rest expands. Feel for deformity over the upper shoulders and chest. Feel for deformity over the upper shoulders and chest. Gentle pressure should be exerted on the ribs from side to side and from front to back. Note any response or grating sensation. Listen for any abnormal sounds on respiration or for the grating sound of broken ribs. Check the abdomen and lower back. Look for any obvious deformity or discoloration. Look for any indications of wound or bleedings. Feel the abdomen for any indication of muscle spasm or tender areas. Imagine the surface of the abdomen divided into 4 sections by a line on the long axis of the body, crossed at 90 degrees by another line at the navel. Press firmly with the flat pad of your fingers in each of those sections of the abdomen, including areas below the belt line. Feel along the spine and lower back for any indications of deformity, bleeding, tenderness, or muscular spasm. Check the pelvic area. Look for obvious deformity or discoloration. Look for any indication of wound or bleeding. Look for abnormal position of leg. The leg rolling outward may indicate injury to the hip. Feel for injury of the pelvic bones. Position your hands on the side of the pelvis and press inward on both sides simultaneously. Without moving your hands, press on the front of the pelvis so that pressure is exerted front to back on both sides simultaneously. Note any instability, grating, or pain. Check the buttocks. Look for obvious swelling or discoloration. Feel for irregularities or bleeding. Check upper and lower extremities. Look for obvious deformity or discoloration. Look for any indication of wounds or bleeding. Look for abnormal movement or position of the limbs. Look for lack of symmetry between limbs. Feel for tenderness, deformity. Look and feel for indication of injuries to the feet and hands, and the major joints including the shoulder, elbow, hip, and knee. Complete the examination of one arm before moving to the next arm, similarly for each leg.